Welcome to another health and wellness segment. Hi, I'm Dr. David Kerr. Now, some Jamaicans know it as a low blood count, but the correct medical term is anemia. And on today's episode, we'll be focusing on the symptoms, causes, diagnosis, and how to treat anemia. Now, anemia is defined as a low amount of red blood cells in the body. Now, the medical report can define it as a hematocrit or hemoglobin. Now, hemoglobin in the red blood cells is the main protein that is responsible for carrying oxygen around the body. Now, as you can imagine, if you have a low anemia, you will have low hemoglobin. And as a result, the organs and tissues around the body won't get the oxygen it needs to survive. And so therefore, you can start to develop symptoms which include fatigue or shortness of breath. Of note, women, young children, and older adults are more at risk of having anemia. Also, anemia can be passed on through the genes, and infants can be born with it at birth. Also, women are at risk of having anemia, of having iron deficiency anemia, to be specific, for heavy periods and higher blood supply demand during pregnancy. Also, older adults are at risk of having anemia, for example, those who have chronic conditions such as kidney disease. Now, in terms of the symptoms, they can be mild and you may not experience any symptoms. But if your red blood cell count decreases below a certain level, you may begin to have symptoms, which would include having shortness of breath, feeling fatigue or feeling weak, having pain in your bones, chest, belly, and joints, skin that is pale or yellow, having shortness of breath, or having cold hands and feet. Now, there are more than 400 types of anemia, but they're divided into three main groups: anemia caused by blood loss, anemia caused by decreased or faulty red blood cell production, and anemia caused by destruction of red blood cells. We'll be focusing on the first two groups. Now, anemia caused by blood loss. Now, you can lose red blood cells through bleeding. This can happen slowly over a period of time. Now, certain conditions that can cause this include gastrointestinal conditions, such as ulcers, hemorrhoids, we know it as piles, and gastritis, which is inflammation of the stomach. Now, non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin and ibuprofen, if you don't take the necessary stomach protection pills, can cause slow bleeding over time because they can cause ulcers and gastritis. Now, as we said before, a woman's period can also is as a part of this group and can lead to anemia, as well as after surgery or after any major trauma, you can have blood loss. Now, the second group, anemia caused by decreased or faulty red blood cell production. With this anemia, your body may not create enough blood cells, or they may not work the way they should. This can happen because there's something wrong with your red blood cells or because you don't have enough minerals and vitamins for your red cells to form normally. Now, conditions associated with this group include bone marrow and stem cell problems, and deficiency anemia, as we spoke about with females, sickle cell anemia, and vitamin deficiency anemia, especially for those who don't eat meat and are strictly vegetarian and they don't take supplements including B12 and folate. Now, in terms of the diagnosis, your doctor will order a complete blood count, and this will measure red blood cells, hemoglobin, and other parts of your blood. The doctor will also ask you about your family history and medical history. Now, in terms of the treatment, as you can imagine, as we mentioned before, there are many types of anemia, so the treatment will be varied, but we'll be focusing on a few. Now, if it's caused by blood loss, you might need surgery to fix that bleed. Or if the blood count is at a certain level, you may receive blood transfusion in the hospital. If you have iron deficiency anemia, for example, as I mentioned before with women, you probably need to take iron supplements and change your diet. Now, for sickle cell anemia, the doctor will include painkillers, folic acid supplements, intermittent antibiotics if they have an infection, or oxygen therapy. A drug called hydroxyurea is often prescribed to decrease sickle cell painful crisis. Now, if you have vitamin B12 or folate deficiency, as with strict vegetarians, the doctor will prescribe B12 and folic acid supplements to provide that supplements in your diet. For other types of anemia, you may need to refer to a specialist for further treatment. Now, thank you for joining me for another health and wellness segment as we continue on the journey of obtaining, maintaining, and restoring good health. Please see my contact information on your screen, and remember to follow me on YouTube and Instagram at Dr. David Kerr, and on Facebook at Dr. David S. Kerr. Send me any questions you may have, especially on this topic of anemia, at my Gmail address at drdavidescar@gmail.com. Thank you for joining me, and remember, God desires us to be prosperous and to be in good health, even as our souls prosper.